Well, Dave, it seems like it's been a year or so since we've talked about cruise ships and COVID with the no sail order and things like that. Things have been changing somewhat, and we'll try to give folks an update on our views, but also on what's happened with CDC and things like that.
Sounds good. Yeah, things are still changing sometimes on a daily basis, especially over the last, I'd say, month. We all know that COVID has had a tremendous impact on the cruise line industry. Going back, it's been over a year now, almost 14, 15 months since we've had anybody sailing out of the US. And during that period of time, the cruise lines have really worked very hard developing protocols to ensure that as always, the cruising is a very healthy place to be. And they brought in people from all over the world, experts in everything from food service to hotel business work to looking at HVA systems. It's been very, very intensive. And CDC, has finally come out with some guidance, and they continue to update that almost on a daily basis. And they call this a conditional sailing order. And in that conditional sailing order, they made it clear of what the cruise lines had to do in order to be considered or approved for sailing out of U.S. ports, in and out of U.S. ports. And we hear that just this week, CDC has given conditional approval to, I think, just 2 ships, one Royal Caribbean ship, the Freedom of the Seas, and a celebrity ship, the Celebrity. So sometime next month or so, they're actually both going to be doing trial cruises. And these are cruises that have volunteers on board. And there's a lot that had to be done above and beyond what we've seen in the past in the way of public health requirements for the cruise ships. They've now had to go in, and I guess I was reading the other day that the whole public health manual, with all the protocols, requirements, and protocols for Royal Caribbean is now over 2,000 pages, and is much more comprehensive than what you and I have been working with for many years with just the VSP, the Vessel Sanitation Program's operational manual. Mm-hmm. And on all of this, we know that sooner or later, CDC will start going out and inspecting these ships again, making sure that they still do maintain adherence to all the VSP public health regulations that we've had for 30 years, 40 years,
at least,
as well as all of these new ones. These new ones are much more comprehensive in they've had to get all the ports involved. Any port they go into, they have to have assurances that they're also doing a lot to mitigate the risk of COVID. They've done a lot to say that if we do have COVID patients, what are you going to do? We're going to allow you to bring them on shore and put them in quarantine there or on the ship. A lot of discussions about vaccination, and we'll talk about this off and on. The cruise lines, I think CDC told the cruise lines, there's a lot more you can do and a lot more freedom you will have if you can assure that a very high percentage of your passengers and crew are vaccinated. CDC says you have to have this trial cruise with volunteers unless you can assure that 98% of the crew and 95% of your passengers are vaccinated.
And that was one of the things too. I think when you had mentioned the freedom of the season, was it the Celebrity Equinox? Was it
Edge? I think
Edge, because the one of those is actually going to, well, the way it's been in the media is that they're going to have that threshold met, and they can actually do a regular 7-day cruise. CDC has cleared them for a regular 7-day cruise. Maybe it was one of the other celebrity ships, but yeah, that they'll be able to sail without doing the test cruises and things like that. We'll see. There's some challenges. We'll get into it a little bit more. There's some challenges here in Florida, since I live in Miami, that are in place, that they can't, kind of the don't ask, don't tell sort of thing with whether you've been vaccinated or not. So it's going to be, I see some real challenges with trying to document whether people are actually vaccinated if you can't ask that question. So it'll be interesting to see how they go forward with that.
Yeah, and I mean, we can kind of talk about that briefly as far as, CDC says, hey, we want everybody vaccinated. And the cruise lines, I think, are really pushing to have 100% of their crew having received vaccinations. And they can't control that. But then, as an aside to that, we realize, again, most of the crew are, and they're trying to bring those crew back after a year of being away. And we're realizing now that they're looking very closely at what countries are they coming from and what are the rates of infection with COVID-19 in those areas. We were reading something last week that the US has suspended, again, travel for folks coming from India and even some of the European countries and a couple of the Caribbean countries because of high infection rates down there. This will have a potentially significant impact on crew being repatriated from their home countries and where they are, because they're coming from there. Now, the cruise lines will, in all cases that I know of, is when crew are coming back, they are being vaccinated. They are actually being put into quarantine before they're allowed on the ships. So they're doing everything they can, but they will do whatever they can to make sure that 100% of the crew are vaccinated and monitored on a regular basis. The issue with vaccinating passengers is interesting because, as we talked about in Florida, where many of the crews will come from, they now have the governor's put out an executive order saying that you are not allowed to ask someone their vaccination status, whereas CDC is very clear that you have to know whether or not your passengers have been vaccinated. So how they're going to agree to that? I read this morning that they're supposed to be getting together between the governor's office and CDC with a mediator to try and figure out what's best in order to allow the ships to sail from there. It also then, if you're looking to achieve a 95% vaccination in passengers, then how do you deal with cruise lines like Disney, which have a high percentage of children?
Yep.
And
under 12, under 12 years old is going to be a challenge.
Yeah, Pfizer has said, okay, our vaccine is good from 12-year-olds on up, but a high percentage of Disney passengers are less than 12. So a lot going on in that area. I'm not sure what the final answer is going to be. We do want to note, though, that a lot of what the cruise lines have done have been very successful. Let me pull out we know that Royal Caribbean has actually been sailing. So we know that the Infection and Prevention Control Plan, which I said is now over 2,000 pages for Royal Caribbean, but to date, they've had over 100,000 passengers sailing on the Quantum of the Seas out of Singapore, which is a non-vaccination area. And only 10 passengers have been identified with COVID-19. No cruises have been canceled today due to any outbreaks. So, the important thing is what the cruise lines are doing is working, and anything they can do to maximize the number of passengers that are also vaccinated is going to go that much further.
Oh, absolutely. And there's some others in Europe. I mean, MSC has had some been cruising out of European ports for at least a couple of months. I'm not sure exactly how long, but yeah, they've had good success. So there are people that are being able to cruise and being able to deal with things. They've had, I think NYK even had one where they had a positive case that they quarantined them on board, isolated them on board the ship, and went back to Yokohama and discharged. But sounded like there was only the one case with that. So yeah, it's positive in the things that they've put in place. And a lot of it goes back to some of the things that we've been doing land-based as well, with social distancing, masks, things like that, to try to minimize that, and testing. And so I think probably a lot of what will happen, even in the event in Florida as well, if CDC is probably obviously going to require that everybody be tested prior to coming on board, whether they do it prior to coming on board, or whether they go to the 72 hours like the airlines are doing and things like that. But yeah, a lot of those things are positive. Obviously, with vaccination, is I think most of us from a public health background are 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 definitely not anti-vax people, or most of us
Sure.
aren't. That we feel very strongly about that, and hopefully, yeah, there's a way that they can sort of get that in there. The other thing that was interesting with the CDC's with CDC and what came out with the cruise ships when it came to fully vaccinated people, if you met that threshold, yeah, they were going to relax the self-service buffets, self-service drink areas, things like that. So it all almost gets back to a normal cruising, to at least to an extent. And that was a discussion you and I had early on when it came to some of the things that they were looking at, such as self-service buffets. And you and I share, I think, the same opinion that it's not the food that's the issue. That's another issue that the cruise lines have to get back and be on the guard for later. But COVID isn't a foodborne illness. It's a respiratory illness. And so, what we felt was the bigger issue in the buffets, and that was the distancing, because we've all sailed on and working on the
Yeah.
ships, and you go up when it's dinner time or lunchtime, and it's a madhouse in there with people crammed together, getting their food and fighting for a place to sit down and things like that. That, yeah, the distancing tends to be that real problem with it when it comes to a lot of these things.
Yeah. One of the discussions that I've had again is with all this focus on putting together mitigation for COVID. What impact does that have on the normal traditional historical work that's been done for public health when you look at food safety and ventilation and kids areas and all that kind of stuff. And I know one of the things that was clear, at least in the initial CSO from CDC, the conditional sailing order, is social distancing had to take place, and that they would shut down the spas, they would shut down the theater, they would shut down any area of the ship, including the pool and the areas around the pool, unless you can maintain social distancing. And even with that, they said no. Again, as you mentioned, with the buffets, you can do social distancing with a buffet. You can go, most of these buffets are set up to where they could be served as opposed to self-service. But again, the big impact on the crew required to do that as opposed to self-service. So these are all things where we were concerned that the normal operating public health practices kind of might go by the wayside with all the focus on COVID. And how important it is, and all the discussions that we've had with the cruise lines that we work with are very clearly saying, yes, we understand, we know we have to do everything we did before. In addition to that, we have to do everything we can to mitigate COVID.
Mm-hmm.
But even as recently as what this is dated May 26, 2 days ago, CDC has significantly relaxed some of the rules on the cruise ships for fully vaccinated passengers. And again, this goes back to them being able to vaccination status of their passengers.
Right.
New update issued Wednesday said the cruise line may designate areas as only acceptable to fully vaccinated passengers. And this means that they can advise the passengers they don't have to wear masks. And they're saying, in addition, for ships of at least 95% crew, 95% of passengers fully vaccinated, cruise ship operators at their discretion can advise passengers and crew they don't have to wear a mask or maintain physical distances in any areas.
Right.
Which will be interesting. Again, I don't know whether they're going to issue armbands or wristbands by color or whatever. But you know, they can go into certain areas. They may gather or conduct activities outdoors, including engaging in extended meal service, beverage consumption without wearing a mask. And we're even talking about self-service. So for ships that can meet that vaccination standard, it may be pretty much business as usual.
Yeah, because they were even saying the casinos would be open. They
Yeah.
could open the casinos as well.
Casinos, bars, spas, entertainment venues, dining areas, including self-service buffets.
Mhm.
So that's really just 2 days ago. And that was a big surprise for us because
Yep.
we did not think that CDC was going to allow them to get to that. Now, again, I think still inherent in all this is that they're not going with a full complement of passengers.
Right.
I think
Right.
they're still, for the most part, 50%, somewhere along in there. So, and that's going to help with maintaining physical distancing where they can as well.
And some of the other things that you said, and we won't talk about it today. We have some of our colleagues within Global Public Health Services that are going to be involved with doing some of these podcasts as well, getting into more details in some of these other things. But when we talked about, oh, now I lost my train of thought. We were talking about, you know, what happens if somebody gets ill? What happens if you get a case on board? How is that going to be handled? What about going into some of these different ports and things like that? I saw one where they were opening it up that people could go on their own excursions. They didn't have to have this bubble that they were dealing with. So all of that's very positive.
If vaccinated.
If vaccinated, that's correct.
Right.
That was one of the things. That's if vaccinated. Yes, that is the key. So yeah, there's a lot of those very positive things with that. But going back to the crew, I mean, the crew, you said, yeah, that is manageable because that can be part of the employment requirements and things like that. One of the things that we at GPHS get involved with on the ships in the past, though, was doing a lot of training, crew training and things like that. I think that's going to be even more important right now with people coming back, because like you said, there are areas where hiring is restricted. India is one of those because of the high counts that they're having there. Well, that means they're going to be bringing on a lot of crew that maybe haven't never worked on board a cruise ship. So the training is going to be paramount to make sure that they understand what the requirements are, how it's different from what they may have been doing if they were working shoreside and things like that. But also just finding crew. We've got a lot of new ships being still built. We were reading about NCL that they're going to take a slower approach at opening up that. So yeah, it's not going to be everybody sailing at the same time. It's going to take time for them to be able to restaff the ships and get them back into position, and that starting up equipment that's not going to run because it's been sitting dormant for a year or so. So there's going to still be a lot of challenges with the cruise line. So they have some that the ships that have been sort of sailing in and out of ports, living in port cities. People have been seeing ships come and go because they had to get water, they had to get fuel, they had to offload garbage and all these other things with the crew on board. So there's some that are warmed up. There's some, I think Viking has had a staff on almost all of their ships, not full staff, but keeping them ready and anticipating some of these things. So yeah, we'll see how quickly they can start up and get things. But yeah, there's a lot of work. The pathway has been cleared a little bit for them to open up. And you had said something too. We had seen that with CDC, if they look to do test cruises, they have to have an answer back in 5 days.
Yeah, back in the original conditional sailing order, they were saying that again, the vaccination, the ships could bypass their simulated voyage if they had 98% of the crew, 95% of the passengers. I think they've relaxed that a little bit. once the cruise lines would submit their specific plans for each ship, CDC was taking 60 days to get back to them. They're now saying they're going to do that within 5.
Right.
They're continuing to update their testing and quarantine requirements on when people must be tested. I think on the simulated, they have to show a test before they go on board. They're tested when they get there. They're tested at the end of the cruise, and they have to agree to provide additional testing 3 to 5 days after their return home.
Yeah.
Probably one of the biggest things that they've had to do are these port agreements. And this is where they have to enter into agreements with all the ports they may be going to that provide relevant port and local health authorities that have to sign off on to make sure that everybody goes by the same standards. I was reading again this morning that the ports in Alaska, Alaska finally, Biden just signed off on a kind of relaxing or suspension of the Passengers Vessel Service Act, what we know as the Jones Act, that requires the ships to go through a foreign port before they come back into the U.S. port, and they don't no longer have to do that. So many of the ships are trying to gear up, and some of their initial voyages will be sailing out of Seattle up to Alaska. So I know the folks in Juneau and Ketchikan and Sitka are all getting together to make sure that they agree on having one plan for all the Alaska ports that they can sign off on, provide to the cruise lines so they can submit that as part of their request to CDC. So they can start getting up to Alaska, hopefully in late July. And that's been a huge impact on the Alaska economy. So the bottom line that.
Go ahead.
Go ahead.
Well, the one of the things to point out too, if people aren't aware, that there have been ships going to Alaska. The U.S. flag ships, the smaller, under 200 passenger ships, it's probably been a boon for them. They probably are sold out, and everybody's taking cruises up there on those. But yeah, they just don't have the capacity. But yeah, there have been ships sailing up there. They've been successful. They haven't, from what I've not read anything where they've had any cases since they've been sailing up there. So that they have been. If you want to go to Alaska, there's a way, but you better book in a hurry and try to find one where there's a bed available. So.
Well, I think all in all, the points that we want to leave with everybody is that the cruise lines have done a tremendous amount of work.
Absolutely.
That in addition to all of the new rules, regulations, recommendations that have come from a myriad experts and people, as I mentioned earlier, over in Singapore, they've been effective and they've been shown to be effective. We know that, our history is working with CDC's vessel sanitation program and all those public health standards. And there's still standards, there's still requirements that the cruise lines must meet. And CDC will get their inspection program back running. We're not sure when, but I think as the ships start sailing, again, a few at first and then building from there, I would expect that we'll see a concurrent increase in CDC folks getting back out there on the ships. Again, making sure that they're maintaining all those standards. It's usually for public health, as in the VSP operations manual.
Right.
In addition to all the new rules and regulations that CDC has mandated under the CSO and everything else that they've done. So they continue to do a great job, I think. We've said all along, we've been big proponents of public health on cruise lines and the cruise line industry. And I don't see any changes that would, change my opinion. I still think it will be a very safe and healthy way to go.
Absolutely. I mean, it's in their best interest. I mean, they're in the hospitality business to ensure people have enjoyable vacations, but as part of that, part of that whole piece of it is that preventing people from getting sick from taking a vacation, and so
Yep.
that's the key. And I look forward to getting back out and working with them. It's always been a pleasure working with the crew on board the ships and things like that. They're great people to work with. Be nice to see the vessel sanitation program people back in their normal element instead of being sort of detailed to different agencies and things like that. So yeah, it'll be nice to get back and see how everybody's doing and how everybody fared through this last year plus. So
I agree.
good.
So I think we'll have some future pods coming up. I think one per month, somewhere around the first of each month. And I believe that Gus Skinner, who is formerly with the Canadian Health Program,
Mm-hmm.
is going to be talking about some of the specific changes and challenges of COVID on the cruise ships. So until then, I'm out.
Same here. All right. Take care.